we're going to be discussing pelvic health, specifically the pelvic floor, right? So could you tell us, for those who don't know, what are the pelvic floor muscles? And I guess this is a three-part question. What do they do and why are they important?
Pelvic floor muscles specifically are a group of muscles that everyone has. Men and women have these muscles. A lot of people think that only women have them, but men have them too. They're responsible for keeping us continent, so they're making sure that we don't have accidents on ourselves, go to the bathroom on ourselves. They're responsible for supporting us. So think about if you have back pain or joint pain, particularly in pregnancy, these muscles are responsible for helping reduce that load, whether you're pregnant or not. So they're super responsible for supporting us. And then they're also responsible for sexual function. I always tell patients that think of your pelvic floor like a hammock. So they start at the front of our body near our pubic bone, and then they come underneath us and attach to our tailbone. So they are literally a supportive muscle group, like a hammock would be.
Can you tell us a little bit more? I think you mentioned childbirth, but are there other instances where we could have dysfunction with our pelvic floor?
Yeah, so a good way to think about the pelvic floor muscles is some patients or people can have overactive pelvic floor muscles, meaning at rest when their muscles should be nice and relaxed, their muscles are kind of activated and turned on. And so that's an issue in itself that can cause a lot of problems. And then also patients can have, or people can have underactive pelvic floor muscles. And so that's going to cause a whole other group of issues. Some of the issues that those can cause can happen in both of those situations. And patients can develop either overactive or underactive pelvic floor muscles for several reasons. Stress. So you think about people that are stressed out. I know for me personally, I carry a lot of stress in my shoulders, so I walk around like this if I'm stressed out. Some patients actually hold that stress in their pelvic floor, and there's actually a lot of research to show that trauma, instead of experiencing that trauma somewhere else in your body, you can actually develop overactive pelvic floor muscles and be stressed out in the pelvic floor area, almost like you're clenching. And most patients that I treat aren't even aware that they're doing this until I start asking them questions like, hey, have you ever noticed if you're on the phone with somebody that is kind of annoying that you're clenching your pelvic floor? And they're like, yeah, ever since you said that, I noticed that I'm kind of holding my breath and clenching all day long. And so that can obviously, if you have that overactive pelvic floor, that can cause pain. That can make it difficult for you to be able to turn those muscles off. As important as these muscles are to turn on and support us and do everything that I mentioned earlier, these muscles also need to be able to shut off and relax. And if they don't, you'll have pain. You won't be able to empty your bowels. You won't be able to have a full bowel movement. You won't be able to go to the bathroom efficiently. You can have pain with intimacy. And so that's what would kind of present in a patient that has overactive pelvic floor muscles. Those patients can also have incontinence as well, because those muscles are so fatigued and tired from being engaged all day long that they don't do their job properly and keeping you from having an accident on yourself. Now, I mentioned stress in pregnancy. You can also have issues with your pelvic floor, whether it be overactive or underactive because of surgery, because of having the baby. And a lot of people think, oh, well, I had a C-section. I didn't have a vaginal delivery. There's a lot of research to show that even just carrying that baby for 9 months and having that C-section because of where they're doing that incision to get the baby out can cause pelvic floor issues after you have the baby. So,
curious question that I had is, how common is this problem for women?
So there's some research to show, it depends on what research you look at, but depending on the lifespan that you're at, especially in a woman that's gone through menopause, they say anywhere from 20 to 30% of women will experience incontinence throughout their life. But if you ask me or anyone else that works in this field, it's probably highly underreported by patients because it's not the easiest thing to talk to about your provider. And so I'll encourage all of you guys out there, if you're having any of these issues, find somebody that you trust, whether it be your primary care provider, your OB, whether it be the doctor that you're seeing for your shoulder. Ask somebody that you feel comfortable talking to about this and see what they say, and ask them if you can have a referral to a physical therapist or what other treatment options they would suggest.
But what do symptoms of pelvic floor dysfunction look like?
Most of the time in my patients that have that overactive pelvic floor, if we're going to kind of categorize the two, they're going to describe to me that they have a lot of pain, that they have difficulty or pain having bowel movements, that they feel like they can't fully empty their bladder. If they're intimate with their partner, it maybe is painful. Maybe they're avoiding that at all costs because it does hurt. A lot of patients that have had a vaginal delivery with pregnancy, they might have a little bit of tearing from having the baby, and then they have scar tissue after. And so they'll say, that area is really sensitive and it hurts. And again, I know I said earlier, even though they have overactive pelvic floor muscles, they can still present like having incontinence in these patients. They'll have constipation. And so these are all things that pelvic floor physical therapy can help with. And I want to mention, when a woman goes through menopause, we know that those hormones that are responsible for keeping all of our vaginal tissue nice and strong, those hormones go away after we go through menopause. And so after those hormones go away, those pelvic floor muscles, the research shows that they get weak and they get smaller, and that vaginal tissue will thin out. So some of my patients like that will explain to me that they're having incontinence, but they're also having pain with intercourse for that reason. That tissue isn't what it used to be when we used to have those hormones. And so that's primarily why a lot of older women, maybe they went their whole life, even after children, not having symptoms, but then now that they've gone through menopause, all of a sudden they're like, I'm having all these issues now that I'm older. Why is this happening to me? And so those hormones play a role in keeping everything going. And then once they're gone, unfortunately, things start to show up. And then my patients that have that underactive pelvic floor, they're going to kind of describe what I was talking about earlier. They might have some accidents on themselves. They might feel like things are kind of falling out. Primarily, patients will describe that they're leaking urine, usually with coughing, sneezing, laughing, exercising. I have a lot of patients say that they try to jump on the trampoline with their grandkids or their kids, and that's when they feel like everything is coming out or they're having an accident. They'll also, a lot of my patients will have issues with urination with urgency. So they'll tell me, I'm sitting there, I'm fine, and then bam, I really have to go to the bathroom, and I feel like I have to run to the bathroom and I can't make it in time. So that's another symptom that I primarily hear from my patients.
Do you recommend pelvic floor therapy to correct a prolapse?
Yes, so that is the medical term for what I was kind of describing earlier. So feeling like everything is kind of falling out of you. So you can have a prolapse of your bladder, your uterus, or your rectum, or all three. And that happens because of a structural issue. So whether you've gone through menopause, whether you've had surgery, whether you've had a baby, those pelvic floor muscles aren't doing their job of creating that hammock and kind of holding everything up. And so the research actually does support pelvic floor physical therapy for prolapse. Prolapse is usually graded on a scale of severity. And so the research shows that with good pelvic floor muscle training with a physical therapist, we can reduce the grade of a prolapse by 1 grade. I know a lot of patients are offered surgery, but if you're one of those people that maybe wants to try something a little bit non-invasive first before you have surgery, definitely try to get a referral to a physical therapist if you're experiencing symptoms of prolapse.
How does physical therapy address the symptoms of pelvic floor dysfunction?
As a pelvic floor physical therapist, I live in this world of the muscles that you see on this picture here. Carol, I hope you're paying attention. So it's really important to assess the pelvic floor muscles, which you can see in the bottom of this picture here. And you can really see in this picture how they create that hammock-like structure. But we also need to make sure that these other parts of the muscles, or the other parts of the 4 core muscles, are moving and activating and relaxing well. So your pelvic floor, when you do a Kegel, which is just a contraction or squeezing those pelvic floor muscles, That's really important. But if your abdominal muscles, your transverse abdominis muscles aren't turning on well, or maybe they're staying on all the time, that's going to make it difficult for your pelvic floor to do what it needs to do. So this picture does a really good job of showing how your forecore is a house. So your pelvic floor is the bottom of the house. So you think about structurally, it's holding everything up. The transverse abdominis is one of your walls of your house. So when you contract your abdominal muscles, everything kind of cinches in. And then your low back muscles or your multifidus muscles are the other wall of the house. And then your diaphragm is on the top. So that diaphragm is moving up and down when you breathe. So another really important thing, if any of you guys want to kind of try some of these exercises later, is that you're breathing. A lot of my patients, they'll do Kegels with me and they'll contract those pelvic floor muscles, but they're holding their breath. And what happens when they're holding their breath is they're increasing that intra-abdominal pressure. And that pressure is actually pushing down on those pelvic floor muscles. And so they're fighting against themselves. They're doing a Kegel, but because they're holding their breath and they're not moving that diaphragm to where it needs to be, and they're not doing a good job of engaging those abdominal muscles, their Kegel is not as, or their pelvic floor contraction is not as good as it could be if they were actually to learn how to breathe. So we're going to talk about that a little bit later.
Wow. So it seems like there's a lot, really goes very in depth with not only actually doing the exercises and even teaching how to do the exercises, but also with education, just some habit changes that we can do that can help. That's so insightful. It really is. And it makes a lot of sense, and I hope is helpful for our viewers back at, kind of moving on a little bit more to that strengthening aspect of the pelvic floor. So could you tell us a little bit about kind of how we can do that at home for ourselves?
Yeah. So if you want to go ahead and pull up that second picture.
Sure. Yeah. Let me pull that up. Give me 1 second. I'll have that up there for us. Okay. There you are.
So this is a great picture to kind of talk about what I was telling you guys about earlier, the importance of breathing. And so the first thing that you want to do to make sure that you're doing a Kegel correctly is to make sure that you're not holding your breath. And we actually want to exhale while we're doing a Kegel. And that's because when you exhale, your diaphragm is actually moving back up to where it was sitting before you breathed in. And as that diaphragm moves back up, the pelvic floor will actually respond to that and kind of recoil and almost contract. Whether you're aware of this or not, that's actually happening every time you guys take a nice deep breath in and breathe out. So I always cue my patients to breathe out through your mouth like you're blowing out through a straw. And then while you're doing that, you're going to try to squeeze your pelvic floor muscles. And a lot of cues that I give to people so they know how to squeeze is squeeze like you're trying to hold in gas, squeeze like you're trying to stop the flow of urine. So while everyone is sitting at their chair, what we can all practice this together. You're going to take a nice deep breath in through your nose, breathe out through your mouth, and squeeze. And what you should feel happening is that as you exhale, your tummy is actually kind of deflating as well because you're blowing that air out, which means your lower abdominal muscles are kind of kicking in, those transverse abdominal muscles that I was talking about earlier. And you might even feel your pelvic floor tighten and lift up and away from the seat that you're sitting on. If you don't feel that, that's okay. If you're not sure that you're doing it correctly, I would highly suggest trying to see someone because there's a lot of research to show that when verbally cued to do a Kegel, just like I cued you guys, up to 50% of women do it incorrectly. And so I've had a lot of patients tell me, oh, I did a yoga class and they told us to do Kegels. I did a Pilates class and they told us to do Kegels, which I think is awesome that these places are trying to incorporate the pelvic floor. But then I have them do a Kegel and they're actually doing the opposite. They're actually bearing down and pushing their muscles out, which can contribute to some of the issues that we were talking about earlier. So because these muscles can sometimes be tricky to learn how to turn on and off, if you're not sure if you're doing it correctly, if you're not getting better after practicing Kegels, then I would highly suggest trying to go see someone like a pelvic floor PT.
Jana, this has been so informative, and I can just tell by all of our viewers tuning in that they just really are enjoying all of this information, because it's just, I know personally, I've just learned so much. So thank you for walking us through actually how to do it, and really explaining more about, pelvic floor, and that, if we're having these problems, we're not alone. It's very
No,
common.
very common.
So really to talk to a professional to get some help for these. So really appreciate that. So we are coming up on our time for tonight, but in closing our conversation, I just wanted to see if you had any kind of last, and what I like to call pearls of knowledge, that you wanted to leave with our viewers for today.
Yeah, and you kind of just touched on them. I know that it might be difficult to bring some of these concerns up with one of your healthcare providers, but I really encourage anyone out there that's experiencing any of these symptoms to just speak up and ask for a referral to come see a pelvic floor physical therapist. And then if you're pregnant, you can actually see a physical therapist during your pregnancy. You don't have to wait until after. And then if you've had a baby, ask your OBGYN, hey, can you send me to pelvic floor PT? They typically won't send you until about 6 weeks after you've had a child. But the earlier you can get in, the better, because unfortunately, I've had patients that have waited 20 years and the symptoms started when they first had a kid 20 years ago. So don't wait. And I hope that everyone learned something tonight.
Thank you all again so much for tuning in. And again, thank you so much for your time.